Welcome to my channel once again. Today we are going to look at some ethical theories in nursing. Theories of focus include deontologic theory, then our second is the utilitarianism theory, then we'll look at the third one being the teleologic theory, also known as consequentialism. Meaning of ethical theories. So ethical theories are systems of moral principles used to guide decision making in nursing practice. They help the nurse answer questions like what is the right thing to do at a particular moment? 2. What action benefit the patient most? And then 3. What is fair and just? So let's take our first ethical theory. We have the deontologic theory, which is duty-based theory. So it's focused on duty. We state that action is right if it follows rules and obligations. So the action is termed as being right when it follows rules and obligation. So the key idea about this theory is that do what is right regardless of the outcome, because they are focused on what? The action that is right. So an example being respecting a patient's refusal of treatment even if it may lead to death, because you are respecting the patient's autonomy. Patient refuse blood transfusion, you respect that even though the outcome is death. You are actually following rules and obligations that respect patient's autonomy. Then we have maintaining patient confidentiality under all circumstances, where you are supposed to keep patient information private. You are not supposed to release it to anyone outside the facility, despite the consequences at hand. Ethical theory number 2, we have utilitarianism, which focus on outcomes. So this theory is based on outcomes and state that greatest good for the greatest number. Right. So the key idea in this theory is that the end justifies the means. So meaning we are looking at the end of what you are doing as long as it produces a greater good for a greater number of people. So an example being in an emergency, we are prioritizing patients with higher chances of survival than those with lower chances of survival. That's a typical example. We have a case or an emergency situation where a patient on the other side knows that there is nothing you can do at this point in time, and then the patient will actually not survive. You are just supposed to monitor the patient to death, compared to a patient who just need oxygen or sanctioning to make it. You actually focus much more on the patient who is actually going to survive and making sure that the patient survive than the one that is not going to survive, because when you focus on the one that is not going to survive, he might not survive, as well as the patient who has higher chance of surviving. With your little intervention, you also leave that person to also pass out, meaning you are losing two people instead of focusing on the greatest good, because you know this patient could survive with little intervention compared to the other patient. Then we have two, allocating ICU bed to patients with better prognosis. So patients that have high chance of survival are given the room to survive compared to patients who are not actually going to survive in cases. We have our last ethical theory for the day, which is the teleologic theory or the consequentialism. So this is an outcome based theory. So this is focused on the outcome. So actions are judged by the consequences. Right. So the key idea in this theory is that action is right if the outcome is good. So no matter how the action is, whether the action is against the law or not, once the action brings about something good, it's good to go. So example, restraining a confused patient to prevent injury. So the patient is confused and the patient is at risk of falls. At this point in time, you restrain the patient in order to prevent patient falling from bed, or technically patient causing self-harm is applicable with this theory. Then we have two, withholding distressing news briefly to protect patient. So a patient is actually on bed and then technically you know that the patient received a bad information somewhere, that you know at this point in time you should give this information to patient, is going to aggravate the condition, you withhold the news for some time and then deliver it at the right time in order to prevent certain complications or consequences at that point in time. So a simple explanation to all these three major ethical theory is that the deontologic theory is focused on duty, is focused on rule. The law is the law. You are doing it because that's what the rule says. That keep this information, don't release it. You don't release it, despite the outcome, whether it's going to lead to something bad or not. Yours is to keep your rules and your ethics focused. Then the utilitarianism look at majority benefits. So it's better to save the one that is savable than losing both. So you are looking at a huge amount of benefits where you could save a particular number related to other numbers. Then we have the teleologic theory, which has to do with outcome. So here, despite the action taken, whether good or bad, as long as it brings about a good outcome, the theory is good to go. That's all for the day. Thank you for your time. Kindly like, share, comment, and then subscribe.